Michael Curry, and I'm the president and CEO of the Massachusetts League of Community Health Centers. That is an organization which we call a primary care organization that represents 52 community health centers across Massachusetts, over 1 million patients that they serve out of 314 or so practice sites across the state. We serve 97% of the zip codes in the Commonwealth, which means if you were looking at Western Mass, people are driving to a community health center to get their care. In addition, I'm a longtime civil rights advocate who's been doing that for most of my life. I served as president of the Boston NAACP from 2011, 2016, the first chartered NAACP in the country in 1911. And I also serve on the national board of the NAACP from 2014 to today, elected 3 times by national NAACP members across the country to serve on that board. In fact, the honor and privilege of being the only person since the 1970s to serve on that board since Vernon Sport, who was a Tuskegee Airman, or Kivy Kaplan, a Jewish philanthropist who served on the national board. And I have the honor in 2014 and 15 to take a seat on that august body of civil rights leaders. Of course, in the role of a primary care association, the focus of a primary care association representing health centers is to advocate for equity as part of that. It's to advocate for access and quality care, for the resources into the communities that we serve, which tend to be over 60% Black and Brown, that are disparately and predominantly poor, that are a large percentage of immigrants of all backgrounds in the communities that we serve. So my job and responsibility, as well as my colleagues, the Mass League, is to be their advocates, to provide them with the technical assistance, to assist them with workforce challenges, and to really be on the front lines on the policy side to make sure that they have what they need when they need it to serve their communities. And that work continues. And then the social justice side of that as well. We know that police brutality is the brutality that our patients experience. Food insecurity and housing insecurity is what they face when they walk out of our health centers. We know that racism that surrounds us is disparately born on the communities that we serve, and it manifests in their lives, the patients that we serve. So we have a heightened consciousness and a responsibility to be in that conversation and to move an agenda that eliminates the taint of race in all aspects of our society, including healthcare. And we boldly, proudly accept that mission and that charge. The pandemic has changed the approach to the work as I don't get a lot of sleep. So that would be the first of how it's changed things. It means I live and breathe COVID-19, and I have since the early days of this pandemic. It's changed our work in that, we in a community health center space have to provide care. And we're dealing with diabetes and heart disease and cancer. We're dealing with all those societal issues that people came into our health centers before this pandemic started. And then now we're triaging and trying to respond to the many issues that are COVID-19 related. I worry sometimes that we're so focused on the now, what about the tomorrow? And the tomorrow is the measles, and it's the underlying conditions that were here before this disease. So I worry about that, but we're also focused on how we should respond to it. It's changed our lives dramatically because it is, as we know in the medical field, triage. We're responding to the most urgent condition, the most urgent circumstance. But thank God for telehealth and the evolution, the final recognition that we can use technology to provide care. Thank God for our medical providers, who I call superheroes. And if you remember that image of the hallway with all the superheroes, the Superman, the Batman and Batwoman, and all of them lining the hallway, and they're bowing to the clinicians who are walking down the hallway, that is real. That these people were risking their lives and really showing up for us in a way that I hope we never go back to that dark place where we didn't recognize their importance, their sacrifice, their expertise, their service. And it's changed that dramatically because we all now fully see them in a way that we needed to. First and foremost is making sure that we invest in our providers, particularly our community providers, community hospitals, community health centers, that are razor thin margins, operating margins, thin, low days cash on hand. We must invest in them because this is the moment that we created them for, that they should be responding to natural disasters, public health pandemic. And if they're weak, then we're weak and our response is weak. So we need to revisit how we reimburse them, how we resource them in a way that they can respond. Deval Patrick, Governor Patrick, once said when we were investing in health centers around the Affordable Care Act and around American Recovery and Reinvestment Act, he said, as he walked through a health center, he said, the buildings we serve these patients in often reflected what we thought of these patients. And then ARA and the ACA changed that. They put significant investments in bigger buildings and more resources for bigger waiting rooms and more technology and emergency medical records, electronic medical records, and dental care and eye care and substance use services and all the wraparound and interconnected services that a health center need. We need to invest in behavioral health. That's a policy priority as we go forward, the integration of medical care and behavioral health so that we treat the whole body, the whole mind and body, and particularly overall, the focus on health equity. We have an opportunity now going forward to eliminate the taint of race in our healthcare system and eliminate these health disparities that has Black and brown citizens living 10 or 15 years less than white Americans. That is the charge of all of us in this policy moment in the wake of George Floyd and COVID-19. And I'm hoping that those and many more other issues around immigrant rights policies and repositioning families and communities that were disparately impacted with the economic tsunami that is the wake and coming in the wake of COVID-19 are all policy priorities. W.E.B. Du Bois was one of the founders of the NAACP, the architects of the NAACP movement. In fact, he was the architect of the movement before the NAACP, which was called the National Negro Committee. And then the precursor to that, the NAGRA movement, which was a group of Black men and eventually Black women who were organizing. He had a phrase, he said, nothing can be solved that can't be faced. Nothing can be solved that can't be faced. And I think we have some really challenging issues that are as a result of this pandemic, that are a result of systemic racism, that are a result of inequities in how we treat immigrant communities in this country, that are a result of how we treated women and people of different backgrounds and sexual orientation. Nothing can be solved that can't be faced. And now is the time to face those issues.